right.
Very good.
Well, thank you so much for joining us
Absolutely.
today. Can you
Good to be
introduce us to you? Your name, what do you do, a little bit about yourself?
Sure, absolutely. My name's Scott Bowers, and I'm the CEO of a company called Spiras Health. Spiro is Latin for to breathe, and so that's where that comes from. So Spiras Health is a company that I'm really excited about, and excited to talk to you today about that and telehealth. My personal background has been in healthcare for 25 years. I started in Chicago, and it was back in the day that I was learning in my mid-20s that there were more and more individuals who needed better care, better health care. And I learned about Medicaid and individuals who were lower income and were fragile and sort of were falling through the cracks in terms of getting high-quality care. And that's what hooked me. And I've sort of taken a path of 25 years, and sort of my personal career has been around trying to help those folks who need more help, whether they're elderly on Medicare or lower income. And so I've gone from company to company, helping to start and innovate and lead folks who care about the same kind of mission. And it's been a really wonderful ride. Some of my experience has been on the payer side, some has been on the provider side, and I think it's really prepared me well now to be at Spiras, where we have some really dedicated physicians, practitioners, respiratory therapists, nurse practitioners who are really trying to deliver high-quality care.
Mm-hmm. And Spiro means to breathe. I've never heard you guys say that before. What's the thought process behind that?
Well, you could think about that a bunch of different ways, right? A little play on words. I mean, one is oftentimes we'll start taking care of individuals who have breathlessness issues, someone who might have COPD or CHF. And so, Spiris is really literally helping those folks breathe. I think figuratively, healthcare is so challenging to really kind of find your way through that environment. And it's so complicated at times that we're trying to be a solution where we come into patients' homes physically and virtually via telehealth and actually bring them peace of mind and ease and help them to breathe, right? Help them to exhale. So it's been a nice way to remind ourselves why we're here and what we're trying to do.
Yeah. So tell me a little bit about how you do that for the patient. I know you guys partner with insurance plans. So what do you provide?
Yeah. I learned about Spiras in 2015 as a board member, and got closer and closer to it, and joined the company actually as a CEO in January. And the closer I got to it, the more I learned about it, the more excited I got that we were actually making a difference. What we are, Spiras Health, is a company that brings dedicated professionals together to focus on some of the most complex patients. And as I said earlier, we go into the home physically and virtually. We start by getting relationships with the payers, and so they'll send us claims data, if you will, and let us know who are some of the high-cost patients. But we also want to figure out who the most impactable are, who those are that will take action and will follow their care plan and are likely to continue to be high cost if we don't intervene. And so we'll actually bring our nurse practitioner model. We'll bring nurses or respiratory therapists into the community, into the home, and we'll deliver care and we'll manage care with those folks. And then we'll bring nurse practitioners into the home as well, but this time via televideo. And what that's doing is bringing stability and less exacerbations to those patients. And, what's the value proposition? Well, it's keeping people from having to go back into the hospital. If we can keep them healthy, they don't have to go to the ER. That keeps them happier and their family happier. So they're thrilled with the Spiras Health solution. Payers are thrilled that they're able to save dollars because folks are, they're paying us a small amount relative to what an inpatient visit or an ER visit would be. And actually, we coordinate really nicely with the primary care physicians and the specialists. So it's rare that you find a healthcare solution where, payers, providers, and patients are all really pleased with the solution. And that's what we found over the years that we've been focused on this delivery model.
Yeah. Wow. That's amazing. And tell me how, we're all here to talk about telehealth today. So tell me how you're using telehealth within all this model.
Sure. I mean, it's amazing. First of all, if you think about what's happening with telehealth, think about healthcare spend, what is it, $4 trillion-ish? And, I was reading something that about $250 billion is going to go toward virtual care, toward, sort of telehealth-enabled care. And so, we have a model that's very much a comprehensive model. I don't think that a digital therapeutic is the answer, or a televideo or a telephone is the answer. I think that there's a need for sort of that personal interaction face-to-face coupled with telehealth or televideo, telemedicine, I should say. And so, what we've been able to do is use the technology to continue that personalized relationship with our folks going into the home physically, but then bring in higher licensed nurse practitioners. They're in their white coat, they're creating credibility with the patient, and they are creating care plans, they are adjusting medication. They're doing a lot more now in the home through televideo that we otherwise could have done with our respiratory therapist or nurse who goes into the home and does their assessment and their diagnosis and their treatment. With telehealth, we can now leverage higher licensed folks at a lower cost, and we can take care of more patients. I mean, the other thought I had was, we haven't done the best service to our PCPs, to our primary care physicians. We are asking so much of these dedicated professionals, right? And the fact that Spiras Health can now go in, we can leverage telehealth, and we can extend those primary care physicians where there's otherwise a shortage of nurses and doctors who can't take as many patients. And so coupling sort of our solution to going in the home, and then also using, telephone, video, I should say, as well as some of our remote patient monitoring is really allowing us to monitor patients and stabilize them and keep them much more satisfied with their quality of life. So telehealth has really helped us evolve our original care model as we've pushed the Spiras vision forward.
Yeah, so I guess I'm hearing two different ways that you're using telehealth. You have your nurses that are still making house calls, but they're bringing basically the physician with them on their laptop or iPad. And then you also have this remote patient monitoring aspect where you can kind of track their progression. What are the different technologies that you use to implement that?
I'm not sure everybody understands. When we talk about telehealth, it's an umbrella term that could mean so many different things. And there's a spectrum of technology that we can now use. When you think about that technology, there's a whole lot of dollars and cents being invested into this digital world and this telehealth world. I was looking at some data recently. I think it was 2019. I think there was about $8 billion spent by venture capital firms in this space. I think it was 2020, it was at about $15 billion.
Oh my gosh.
And in 2021, they're already at $15 billion halfway through the year in just 6 months. So what that says is a lot of chips are being put on telehealth and televideo. And, the way we think about it along the spectrum of what are the different solutions could be as simple as a telephone call that now is billable. It could be it could be a video visit with a practitioner. It could be work up the spectrum, if you will. It could be two-way digital communication via text. It could be an app, and in our world, what we've found is, at the other end of the spectrum, there's often patients, and about 25% of our patients can qualify and are sort of that perfect candidate for remote patient monitoring, where we are able to use technology to monitor their vitals in the home and then intervene when the time is right. So we look at it as sort of this opportunity to pick modalities and sort of have multimodalities, figure out where the patient is on their medical journey, figure out whether they're comfortable with technology or not, and toggle up and down how often or what types of modalities we use in the telehealth space. It's really allowed us to monitor patients and understand what's happening in their apartment or in their home when we're not there.
Yeah. And you mentioned everyone that's investing in telehealth, and you guys are too. Can you tell me what you're looking to add to your model now?
Yeah. We last year we were definitely, with the pandemic, pushing toward much more telephone and televideo. This year we really leaned into remote patient monitoring, meaning, a package is shipped to the patient. They open up the package. There is, think of Alexa or some sort of a device. We call it Spiras hub. So think of a hub on the desk, on the table, on the kitchen table. They plug it in, and it says something like, welcome to whatever. And inside that box, it also includes things like, pulse ox to measure, oxygen levels. It could have a scale. It could have a blood pressure cuff. It could have a whole host of devices, medical devices, that then are connected Bluetooth into that hub. And the hub is not required to go through their Wi-Fi, which is really a nice, think simplification, right? We're trying to make this as simple as possible think of my 83-year-old mother or 83-year-old father who may or may not have high adoption rate of technology. So we're simplifying it, plug it in, it speaks to you, tells you what you need to do, reminds you once a day to take your measurements. And if you didn't, it'll remind you. And all that comes back to a bank of clinicians who can monitor, what those vitals are looking like, and then determine whether we need to lean in ourselves or whether we actually might need to coordinate with a pulmonologist or cardiologist to get them better care. That's where we've really leaned in this year, is really on the RPM side. As we look to next year or later this year, I think there's really an opportunity to get more into the continuous monitoring. So think wearables. Think there's bed sheets that are fitted now that while you're sleeping, you're able to monitor certain movements and certain heart rate. So it's we're getting here into like Blue Origin or Virgin Galactic kind of territory, right? Where we're sort of new frontier, very innovative, and how do we use that not just to look at data, but what are you going to do with the data? And so when we think about Spiris, we think about our providers, our practitioners have to be ready to do something with the information. What's the intervention, and how is it going to help improve clinical outcomes? Let's not get hung up on too much technology without remembering it's what you do with it.
Mm-hmm. Yeah, it's remarkable because I feel like what you just described to me will make health an everyday thing for people. It's something that they're constantly monitoring. But as you said, it opens up this vast data for the clinical team that they can actually use rather than just seeing them like the once a month. They get to see their progression over, every single day, which is totally remarkable. And would you expect that you would be able to do that 2 years ago in 2019?
Right. I mean, there's claims data. So what you paid, you're looking in the rearview mirror, right? But now that you have sort of almost real-time or real-time vitals coming your way, and you can actually, adjust medication or adjust the frequency or the type of visit, specialist or otherwise, now that you have that information, it's remarkable. I mean, I don't think it's anything new to a lot of folks to know that big data is here to stay, right? I mean, it's in the news. What we've been doing is using claims data to help us with predictive modeling and sort of set up algorithms that say, what's the relationship between what happened in the past or what the demographic information is on that patient, and let's figure out who we need to target to take care of more frequently, or in more depth. But as you now are collecting more clinical data real time, it just creates such a more robust data set to help you understand that patient in a much more real time setting. And it's not, I'm geeking out on the data and on the technology, but it's changing people's lives. It really is.
Yeah, absolutely.
Yeah.
And so you get all of this, and you guys are, charged with, preventing bad outcomes, helping them get healthier from their chronic health conditions, but they still have their primary care physicians and other care teams. How do you coordinate between, all of that?
Yeah, for sure. we are not replacing any of those providers. We are augmenting, extending their services, helping to coordinate. And so what we love about our model is that, we really are creating a personalized care plan, specialized care, in the home. And so it's creating this accessibility in a much greater way, but it's not replacing the primary care physician or the specialist if they need to go there. And so the fact that we can have, I'll say a respiratory therapist as an example, in the home physically with a stethoscope, listening to the breathing, listening for the wheezing, understanding and being the eyes and the ears back to our nurse practitioner who's centrally located via video. And they enter the home via video, and then they can circle back and do it like a peer-to-peer review with that physician, primary care physician, specialist, or otherwise. The physicians are loving it, right? Because instead of getting that 1 a.m. call from the emergency room that one of their patients is not in a good place, Spiras Health is involved in helping to prevent that from happening. I mean, I just think about the coordination that's required and all the fragmentation over the years. Personal story real quick is in March of 2020, when hospitals were starting to close down and visitors weren't going in, my dad had 2 heart attacks and lost both kidneys in March of 2020.
Wow.
That was before I came to Spiras.
Yeah.
He was that 83-year-old Spiras Health type patient that we were caring for. And I sat in his apartment and I watched home health providers coming and going, and I saw all his medication, on the countertop, and we've had to figure out how to reconcile the medication and how to ensure that he was taking the right medication, and how to coordinate a bunch of different home health providers, and how to work with his cardiologist or work with his pulmonologist that's my personal example of my dad. That happens millions of times a year with people all around the country. And to know that I'm at a company now that is taking care of that exact patient is personal. And I think, we can care for that many more of those kinds of people now. To your point, coordinating care and bringing it all together so it's more seamless and it's more comforting. And so when we bring our folks into the home, we're creating those trusting relationships that allows us to give them more services with telehealth.
Yeah, and I guess that last point really hammers down. It's not that this technology will replace in-home visits or in-person visits. You still have that hybrid, that comprehensive model where you're still seeing the clinician face to face, and you can sort of talk them through these wearables that you guys are going to put through in the future, the technology that they might need to be more familiarized with.
I mean, that's our belief. I don't think that a technology solution solves all problems, as I might have said earlier. I totally agree that if we're in the home and we can help them set up that technology, or if we're in the home and we can stand up either the hub or the video so that they can connect with their physician, if we're in the home and we can, hands-on do the physical, do the assessment, do the diagnosis and the treatment in home, but extend either a physician or nurse practitioner into the home, that all coming together creates, to your point, quite the comprehensive approach. And so having that sort of longitudinal relationship where there's trust being built that's leveraging all this technology and it's enabling higher clinical outcomes is really what our thesis is, right, as to how we continue to stabilize patients and reduce cost at the same time. And that's, you and I talked a bit earlier about value-based care. I mean, that's where instead of us being a company that is simply looking at billing CMS, fee-for-service again and again, we're creating what the industry calls value-based contracts where, the way we get paid is whether or not we're adding value. And so every day we are waking up not just passionate about doing the right thing and caring for the patient, but also thinking about the payer and making sure that as we stabilize and reduce exacerbations, there's cost savings being squeezed out of that $4 trillion that's being spent across the country.
Yeah, absolutely. And that was exactly what I was going to get into next, is your relationship with these insurers, because it is different from, I guess your typical fee-for-service provider that, they want reimbursement for, the telehealth visit, the diagnostics that go into it, all of these things.
Yep.
Yours is more, you're paid for this holistic model that you provide that, prevents these bad outcomes from happening in the first place and reduces healthcare costs.
Yeah, there's no doubt. If you start with the fee-for-service world and you think about some of the changes that have been made in regulations first, it certainly has freed up the opportunity to do more telehealth and do more remote patient monitoring, and providers are able to bill now more. And the CARES Act that came out certainly has created more flexibility for telehealth and televideo. Keep saying televideo, but telemedicine.
Yeah.
But I think what we are the way we're trying to show up to the payer from a financial relationship perspective is to your point, where we don't have to worry as much about, are we billing the right codes? Are we documenting the right services so that we're able to get paid for every single time that we do use one of these technology components, where in some cases that's required. Again, we are creating a financial relationship where the incentives are aligned between the patient, between us, between the community providers and the payer. And in value-based contracts, we don't just talk about cost. We talk about certain outcomes like Borg scores and CAT scores and other kinds of clinical scores that I would get over my skis on if I tried as a non-clinician to explain what all these are. But quality scores, clinical outcome scores, and financial reduction by keeping people healthy and safe and more days in their home with their family rather than going into the hospital makes all the difference in the world.
Yeah, absolutely. And I guess that gets into my next question, or the last question, is that if you weren't able to use telehealth at all, where would Spiras be today?
Great question. I mean, I think our model, starts and ends with personalized relationships and trusting relationships. So with or without technology, there is a place for us as specialty trained clinicians in the home to augment services in the community by the PCP or the specialist, and to connect back to the payer benefits if there are things like over-the-counter benefits or care coordination for community health resources to help reduce social determinant of health challenges. And we're doing all that. And that would continue on. But telehealth has allowed us to do maybe two things. We can go wider and we can go deeper. We can see more patients. We can do it at a lower cost because, we can scale our operating model and our clinical model into the home with a higher panel of patients per field clinician, if that makes sense.
Yeah.
By leveraging some of this technology, whether, again, it's RPM, it's texting, it's telephone, it's video. All these things allow us to see more patients, and that's good for the system. And we can go deeper in that we can get a, higher licensed, qualified nurse practitioner physician into the home, where we otherwise would have had a wonderfully trained but not at the same clinically licensed, respiratory therapist or RN or LPN. And so we can go deeper on, that clinical judgment as well. So, I think, when you think about telehealth being utilized 38 times more now than it was pre-pandemic, I think that's going to continue. I think you're going to continue to have telehealth as being an absolute accelerator to better and more care. And, when you think about physicians being comfortable with telehealth, 84% of the physicians out there are in a survey are saying absolutely they like using telehealth and having virtual care, and 60% of them want to continue doing that. And so that, I think, bodes well for the industry, and it bodes well for our ability to leverage sort of that tech enablement to provide more high-quality care.
Yeah. Fascinating. Well, thank you so much for being here, and congrats on the innovation and everything Spiris is doing. We really appreciate you being here.
Thank you very much, Kara. I appreciate it.